بسم الله الرحمن الرحيم. Questions and answers were on surgical medications, okay? Surgical medications. Questions and answers. What is the mechanism of action? Mechanism of action of the following drugs. Mechanism of action of the following drugs. Following medications. First, penicillins. Penicillins. What's the mechanism of action of penicillin? It is a beta-lactam, have a beta-lactam ring. Act on the synthesis, inhibit the synthesis of cell wall. Inhibit cell wall synthesis. Okay? Penicillins. Aminoglycosides. Aminoglycosides like amikacin, streptomycin, gentamicin, etc. It acts by inhibit what? Inhibit 30S بروتين رايبوزوم. 30S رايبوزوم اللي هي معناها شنو؟ معناها inhibit بروتين synthesis. رايبو. Third, what's the mechanism of action of vancomycin? Vancomycin, it destroys bacterial cell wall. Bacterial cell wall. But how? No one knows yet. Okay? Quinolones اللي هي شنو quinolones؟ اللي مثلا سبروفلوكساسين، ليفوفلوكساسين، نورفلوكساسين. quinolones act on DNA يعني inhibit DNA شنو؟ جايريز انزيم. جايريز inhibit DNA جايريز انزيم. كليندومايسين اللي هو شنو؟ what type of antibiotic? It is macrolide. Okay? Clindamycin is macrolide. It inhibits 50S bacterial ribosome subunit. Inhibit 50S ribosome subunit in bacteria. Okay? This is clindamycin. Okay? What's the mechanism of action of H2 blockers? يعني histamine 2 receptor blocker. معناه يعني من اسمها block the histamine 2 receptors. اوكي؟ مثل من؟ مثل السايمتيدين، رانيتيدين، فوماتيدين. These are H2 blockers. Okay. What's the action of promethazine? Promethazine. بروميثازين it is anti-nausea drug affect medullary chemoreceptor trigger zone. It affect chemoreceptor trigger zone الميدولا اوبلانجاتا الميدولا اوبلانجاتا. Okay. What's haloperidol? Haloperidol. It's the mechanism of action of haloperidol. It blocks the dopamine receptor in the brain. Block dopamine receptors in the brain. لذلك should not be used in Parkinsonians. Okay? Should not be used in Parkinson's disease. Haloperidol is a competitive blocker of dopamine receptors in the brain. Contraindicated in patients with the Parkinson's disease. Okay? Haloperidol sort of tranquilizers. Okay? metoclopramide اللي هو بلاسين. metoclopramide اللي هو بلاسين الاسم التجاري. What's the mechanism of action? It is antiemetic. It's again dopamine blocker but in stomach. Block dopamine receptors in stomach. Okay? What is metoclopramide? We say that. Okay. What's the mechanism of action? Mechanism of action of omeprazole. It's proton pump inhibitor. يعني شنو؟ proton pump inhibitor يعني بلوك بروتون شنو؟ هيدروجين ايون بوتاسيوم هيدروجين بوتاسيوم AT base when in parietal cells of stomach. Okay, block hydrogen potassium AT base pump. The proton pump inhibitor. It inhibits this. Okay. What's the action of sacral fat? It binds ulcer crater فوهة القرحة. المكان مال القرحة بالمعدة ساي ميكوزا وهي قرحة هنا مال ميكوزا مال المعدة هنا القرحة. اوكي فإت بايند هير سكرال فيت. يعني إذا mechanism of action of misoprostol يعني بروستوغلاندين انالوج يعني بروستوغلاندين صناعي بروستوغلاندين انالوج. وش يسوي بروستوغلاندين انالوج؟ سايتوبروتكشن for stomach cells. ميزوبروستول. Okay. Cyclosporine. What's the action of cyclosporine? It inhibit interleukin 2. Okay. It used as immune suppressive. Okay. What FK mechanism of action of FK506? This is drug inhibit the secretion and block interleukin 2 receptor. It is just like cyclosporine. It acts on interleukin 2 receptor inhibitors. What is the mechanism of action of papaverine? Mechanism of action of papaverine. It is vasodilator, mainly mesenteric vasodilator. Okay. Papaverine is mesenteric vasodilator. Bestracine. It inhibits bacterial cell wall synthesis. Used for peritoneal irrigation. Cause severe nephrotoxicity. Actually, inhibit bacterial cell wall. What's the mechanism of action of digoxin, which is very important? digoxin على عرش الأدوية، يعني يقرب من 150 أكثر من 150 سنة. أدوية القلب. It inhibit صوديوم بوتاسيوم ATPase. Sodium potassium ATPase lead to increase intracellular calcium. Increase intracellular calcium. So inhibit sodium potassium ATPase, increase calcium in the cardiac cell. Okay, so it causes inotropic action. Inotropic action, يعني increase the power of contractility of the heart. This is digoxin. It is an anti-failure drug. فضلا عن الاستخدامات الأخرى. Imipenem is antibiotic. Okay. Bind with penicillin binding proteins and disturb cell wall. penicillin binding protein بالcell wall. Penicillin binding protein. Imipenem bind. This is imipenem. Bind to this penicillin binding protein. and result in destruction of cell wall. This is the action of mepenem. Okay. Silastatin. What's the mechanism of action of silastatin? Silastatin inhibit renal excretion of mepenem. يعني increase the action of mepenem. Inhibit renal excretion of mepenem. Okay, what is it? Silastatin. Warfarin. Okay, warfarin اللي هو oral anticoagulant شو يسوي؟ inhibit vitamin K dependent coagulation factor. inhibit vitamin K dependent شنو factors, coagulation factor, clotting factors. اللي هم وياهم 1972 ألف إشارة إلى 10/9 7/2 1972 1972. Okay, these are vitamin K dependent factors. What about heparin? The action of heparin. Mechanism of action of heparin. Again, it is anticoagulant. Injectable anticoagulant heparin. It activates what? Anti-thrombin 3. This is the action of heparin. Streptozocin. What's the action of streptozocin? Selectively uptake of pancreatic, selective uptake and death of pancreatic beta cell. Selective action on pancreatic beta cells. Okay, simplified. What's the mechanism of action of simplified? It causes what? Acetylcholine release from GI plexi. Acetylcholine release from gastrointestinal plexuses. Okay, result in increased GI motility. Increase gastrointestinal motility. This is what we call simplified. Okay, tamoxifen competitive estrogen receptor blocker. Compete with estrogen receptors. So block estrogen receptor. tamoxifen ذاك يستخدم in CA breast. sulfasalazine sulfasalazine. This is when taken cleaved into two compounds. 5-amino salicylic acid and sulfopyridine. Pyridine. Five amino salicylic acid stay in gut, while sulfopyridine absorbed. فسلفاسلازين اللي هو طبعا يستخدم وين؟ ممكن استخدامه بالكرون ديزيز and ulcerative colitis. What is the mechanism of action of metronidazole? metronidazole اللي هو فلاجيل. mechanism of action, it breaks DNA